Good afternoon, everyone. One of the most significant demographic trends in the history of the U.S. is the current growth of the population age 65 and older. Baby boomers, those born between 1946 and 1964, have brought challenges and opportunities to the economy, our infrastructure, and as we all know, certainly, our healthcare system as they pass through each major stage of life. In fact, July 11th, 2019 was World Population Day, and we were reminded that there are now more people age 65 in the world than there are under the age of 5. According to the U.S. Population Reference Bureau, young and old will continue to grow in opposite directions, placing increased burdens on our socioeconomic system. And as we all know, the costs of supporting the elderly are far more expensive than caring for a younger population. In fact, older Americans make up 20% of the population in almost a quarter of all counties in the U.S. Most Medicare consumers today are college educated. Many are working past age 65, which means they're enrolling in Medicare a bit later. And as smoking has declined over the years, life expectancy for men is increasing at a faster rate today. So non-smoking men like me are living longer too. Today's senior is evolving. They're modern, they're digitally savvy, and they're more geographically mobile than ever. So with today's modern senior, there are as many opportunities with Medicare as there are challenges. Medicare is ever evolving. It continues to be complex for many people. And according to the American Society on Aging, affordability and inappropriate service denials are massive challenges for these beneficiaries. So we need to be smarter about how to approach today's modern senior. Educated consumers are reading books and researching, shopping for healthcare online, but they remain confused about their options. And while they're shopping by themselves online, mostly, the vast majority still seek guidance from brokers and or carrier agents in order to complete their enrollment. So our theme for this year's Voice of the Healthcare Consumer Megatrends webinar is Capture, Convert, and Protect, Today's Modern Senior and Medicare. I'm Bill Keyes. I'm the Senior VP of Sales and Marketing at Connecture, and I'm very pleased to present today with my colleague Jeff Blattner, who's SVP of Innovation and Product Strategy here at Connecture. Jeff has been a former leader in health product management at USAA and a former Connecture customer as well. And he offers a unique perspective on how consumer behavior is evolving and how to use technology to capture, convert, and protect or retain members. So during the next 45 minutes or so, we're going to dive into some trends, insights, some data that hopefully will help you plan for AEP 2020, which is certainly upon us, and beyond. We're going to be able to take questions at the end, assuming we have time, which I believe we will. And you'll be able to type them into the question box on your screen. And I believe you can do that throughout the presentation, and we'll get to them at the end of the presentation. We are recording this presentation, and for anyone that registered or attended, we will follow up with a link to the recorded webinar as well. So Connecture is in our 7th year of surveying consumers about their health plan buying habits. And over the past 7 years, we've surveyed over 14,000 consumers. Today, we're going to talk about responses from over 2,000 consumers from our 2018 health plan buying survey, which is conducted at the end of the AEP period in December. And we'll also be referencing data from Deft Research. Our survey analysis and results are always assessed and reviewed and pulled together by third-party data scientists and consultants. And our insights are supplemented by hundreds of one-on-one interviews that focus on user experience. We use this information and insights not only to inform the market, as we do on these webinars, but also we use this to drive our product innovation and our R&D. So let's jump in. To better understand the survey results, let's take a look at the profile of today's baby boomers. When we talk about key motivators for aging boomers, which are really 65 to 66 age groups, they want to retain their current providers. They have concern about drug costs, and about paying too much for the right coverage. They definitely want to find the best fit plan for their health situation and their budget. And this age group is, as to be expected, is more comfortable with technology than older consumers. They're independent, they want choices, and health plan options seem to be overwhelming as they're aging in. Because they're confused by the government-run system, we're finding that they need a guided approach. They typically have experience with health insurance, whether that's a group or an individual plan, in the past, and sometimes they wonder if they can recreate that medical experience, that same or similar medical experience with Medicare. As we look at older population and older profiles, age 67 and older, these beneficiaries have similar motivations. They want to keep their doc. They worry about drug costs. They don't want to pay too much for the right coverage. They want to make sure they made the right plan choice, but they're not as comfortable with technology. They're hesitant to change plans. They like to stick with what works. And more than their younger counterparts, they'll talk to friends and compare experiences with people they know. They also shop more. Obviously, they have more time. They're retired, and they do consider switching. So where are baby boomers going to get their information? There's a ton of information available. If you look on Amazon as an example, you'll see a plethora of books from a huge variety of sources, along with some interesting customer comments and reviews, which we'll get to in a second. These books really try to demystify Medicare, to help beneficiaries navigate the maze, to try to dummy down Medicare, and really simplify the shopping and enrollment process. And when we look at what people are saying with online reviews and comments, they still see Medicare as very complex, and they start to realize that they're going to need assistance. So as we look at this continuously evolving and changing world that these seniors are living in, where they have access to more information than ever before, how do we ensure that they get the right information at the right time to make the right decisions that is specific to their own health and pocketbook, frankly? So we need to work on strategies to help capture, convert, and protect, hence the theme of our webinar. And so today we're going to talk about how personalization matters, what are the key decision points for consumers, how to best utilize distribution networks to capture and convert, and the importance of drug costs and accurate out-of-pocket estimates to ensure seniors enroll in the right plan. Also, we want to look at converting to the best fit plan to ensure shopping becomes enrollment through building trust with guided assistance, and how to protect or retain your members, including ways to transition or retain current members that will help elevate your brand and really prevent switching. This capture, convert, and protect will help you ensure your success, and you really need to do all three in order to ensure success. So I'm going to turn the mic over to Jeff now, and let's kick off our discussion, beginning with how to capture today's modern senior. Jeff?
Thanks, Bill. The next several slides are all about what it takes to capture today's modern senior. It involves what each beneficiary needs to see that relates to them personally. Capturing stems from an experience and journey where they build trust all along the way. To capture the modern senior, it also requires paying attention to older age-ins. As people work longer and age in later, your marketing efforts may need to adapt as well. An older consumer who has been working longer might be looking at different plan options and have more money to spend on Medicare supplement than a consumer entering Medicare right at age 65. Now let's look at some other shopping trends. Online shopping has increased over 3 times since 2012. People continue to shop online, but the rate is stabilized across all ages and all types of insurance, not just Medicare. Boomers entering their 60s are showing the highest growth in online shopping. While shopping is up, our customer enrollment survey data shows that assisted enrollments are also up. When we look at what's most important for our Medicare targets, the trend has been consistent over the past several years. 3 of the top 4 items that are most important when shopping are the lower monthly premiums, lower deductibles, and lower costs for doctor visits. These are all about out-of-pocket costs. The other items on top of importance to the consumer is the ability to keep their current doctor in their network. What this means in summary is people want 2 things. 1, they want to keep their current provider, and 2, they want to lower costs. This is what they're looking for when shopping. Let's talk about trust. Trust is an area we'll be talking about a lot today. And we wanted to point out that the trust in private carriers in the Medicare space is increasing. We've seen this trend for a while. Also, trust in Medicare for those already enrolled is quite high. Trust in government programs has not been historically high in the past. Trust in Medicare has increased, although trust in other government programs still remain low. We're also going to see a trust in private carriers increasing as people are identifying with private carrier brands from a Medicare perspective as well. As they're starting to age in, where they're starting to see the same brands from what they've got from group or individual insurance, and they're starting to see that as well. Continuing the discussion with trust definitely builds with age. Younger boomers express less trust of Medicare, as the system may be unfamiliar to them. For those entering Medicare for the first time, they are more likely to research plans than those already using Medicare who have higher understandings of the system. Pre-Medicare ages are savvy online shoppers. They enroll with less assistance as compared to their older counterparts. Pre-Medicare ages use consumer ratings and reviews when looking at plans, more so than 67 plus ages. Note that when we spoke about the senior profiles earlier, we also saw that older seniors were more likely to discuss experience and plans with the people they knew. A personalized shopping experience that targets individual health status, preferences, referred providers, and more adds up to consumers being able to make the right plan choice with or without assistance. Nearly 50% of beneficiaries are comfortable with inputting their drugs and want to know if they can keep their provider and see general information about their health when enrolling. The bottom line is boomers are willing to provide data to get a better understanding of how much Medicare is going to cost them. This is a key point, and we'll be talking about that throughout this presentation. These estimates are critical to establishing a more personal experience, which in turn leads to higher conversions. According to depth research, age-in at initial enrollment impacts the plan people select. As people are working longer and aging in later, they are choosing differently. If you capture consumers at 66, 41% enroll in Medicare Advantage with the moderately priced plan, and 45% will enroll in Medicare Supplement. The benefit of having individuals work the extra year and aging in at 66 is that they may have more money for Medicare Supplement. Since the unemployment rate is still relatively low, 2.5% for ages 60 to 64, people are retiring later and with more money. They are more geographically mobile, and these factors help to impact their plan choice. If you capture an age-in at 67 and older, they are more likely to just enroll in original Medicare than a 65 or 66-year-old age-in would. According to depth research, and looking specifically at Medicare Advantage members, we see that almost half of MA members who received help indicated the agent provided guidance in deciding which plan to enroll in for 2019. This analysis further showed that the majority of those who are already members of Medicare plans are not comfortable on their own. Price is important beyond just premium. Drug coverage and provider status in the network are also key decision points. Zeroing in on drug costs or coverage is important for those with prescription medications to understand not only if their drugs are covered, but if they are covered and at what cost. Plan benefits such as no drug deductible or gap coverage are not understood or highlighted if assisters are not helping members with this information. And the one that everyone cares about, which plan to enroll in. Of those surveyed, 46% are looking for assistance with this decision to enroll. Bill, how about you tell us a little bit about what opportunities you're seeing in the broker market?
Thanks, Jeff. So Jeff just talked a little bit about what consumers need to that drives their assistance, but talk a little bit about what do brokers need to help assist those consumers. So we talked a little bit about while online shopping has increased over the past several years, consumers are still confused and look to brokers or call center agents, telesales agents for assistance in the enrollment process. So let's take a quick look at some of the tools that brokers and carriers can use to assist them as they help their beneficiaries enroll, with ultimately the goal to increase conversions, increase enrollments, right? So some of these tools include mobile tools like tablet capabilities that allow quick plan comparisons with not a lot of rekeying, which will save a ton of time. Once a personalized quote is produced, additional easy online tools for the consumer that will allow the beneficiary to complete online enrollment after sending a quote will certainly improve conversion rates. In fact, Connecture, through our customer data, has seen a 63% rate in continuing to the next step in shopping and enrollment when using a personalized quick quote approach. So we're going to talk a little bit more about this personalization as we go on. Certainly the ability to upload appropriate documents to ensure compliance, the use of personal URLs and personalized landing pages for individual brokers are all tools that brokers can use to get the job done and get additional enrollments. And these types of tools will really make a difference this year with the many changes on Plan Finder. We're seeing a high volume of interest in using these types of tools, given some of these changes that are being rolled out on the .gov site. Also want to talk about and call attention to the importance of being able to extend your reach through multi-carrier distribution network. Connecture has built a large partner network throughout the US. We provide access to a broad distribution network of national and regional FMOs and brokers. And year over year, we've seen a 10x increase in enrollments through this network. This distribution tool, this network, is important to have in your arsenal if you're looking for strategies to really reach and connect with and capture more members. So just a little bit of discussion about a couple of options from a broker standpoint. Let's go, Jeff, back to you and talk about how to convert shoppers to enrollments by helping them find the best fit plan.
Thanks, Bill. The key to converting to the best fit plan is conveying the most accurate plan costs. Showing the impact of an individual's drug costs on their total out-of-pocket costs is not only the foundation to personalizing the shopping experience, it is also what consistently drives conversions. What is it going to cost? Will make it easier for beneficiaries to enroll and hopefully enroll sooner rather than later. Now let's talk a little bit about spending. More than 25% of Medicare beneficiaries spend 20% of their incomes on premiums plus medical care, including cost sharing and uncovered services. About 25% of all out-of-pocket costs spending goes towards prescription drugs. Clearly, drug costs are a critical decision point as beneficiaries choose a plan. It's no longer a secret that what lies between every Medicare beneficiary and a successful conversion to the right plan is knowing and understanding the cost of their medications and how it impacts their overall out-of-pocket costs. Finding the right plan or best fit plan is dependent on determining these costs as accurately as possible. So now let's talk a little bit about what happened before and what's happening today. What's the difference between the Medicare consumer? What we've seen in the past is how consumers were just focused on the monthly premiums, thinking that that was the ticket to keeping money in their pockets. The $0 premium plan was their ticket. Today, as consumers increase their knowledge of Medicare, as they have increasing access to better sources of information and tooling, they are realizing that the $0 premium does not equate to saving money. Now they are seeing that their drug costs in staying in network or going out of network to keep their physicians. And to find the best fit plan with all these considerations, they need help. Given that Medicare beneficiaries need guidance and want trusted help from their broker, like we discussed earlier, to find the best fit plan and enroll. The importance of this slide cannot be understated. Of all the means of shopping and enrollment, the broker is the least likely to enter the drug information. And this is what is critical to getting the best match plan for the consumer. So what do we need to do to encourage the broker? It is in his or her best interest to help the consumer or inform the consumer the importance in filling out the drug information. These costs matter the most. Before we get to the meat of this slide and discuss $0 premium plans, let's consider the following industry statistics regarding prescription drugs. A 2017 Consumer Report survey indicated that 55% of Americans regularly take prescription medicine, and those who use a prescription drug take 4 on average. The average elderly patient takes more than 5 prescriptions, and the average nursing home patient is taking 7 medications. The number of prescriptions filled rose 85% between 1997 and 2016. From 2.4 billion scripts to 4.5 billion scripts a year. According to the Peterson Kaiser Health System Tracker, 1 in 4 have a difficult time affording their prescription medicine and out-of-pocket costs for prescription drugs, and prescription drugs continue to increase. As we talked about, drugs count for the biggest share of health spending, more than what many people think. Again, when it comes to Medicare, prescription drug spending accounts for almost every $1 of every $5 in Medicare spending, according to the Kaiser Family Foundation. The majority of Medicare prescription drug spending is covered under Part D benefit and Medicare Advantage plans. The emphasis here is on the fact that the number of prescriptions a person is on, the costs of the medication, and the impact on a person's total health expenditures matters a lot, and it is instrumental to determine the best fit plan. It is this best fit plan which in turn will influence a plan loyalty like no other. I don't think I can say this enough, but Medicare beneficiaries who pick a $0 premium plan may end up paying more. Brokers can easily capture and convert on a $0 premium plan. It doesn't take much to sell that plan, but it doesn't mean that the consumer will stay on that plan. In many cases, they will end up spending more if drug costs are not included in their out-of-pocket estimates, and ultimately, they may also end up switching plans. Now let's talk a little bit about enrollment. In our Connecture Voice of the Healthcare Consumer Survey, respondents answered a question regarding how long it took them to enroll successfully. In looking at the 2017 responses compared to the 2018 responses, we see there's been a significant uptick in the number of successful enrollments. Enrollments taking less than 1 day have gone from 27% to 45%. As a result, the amount of time it takes to enroll beyond 1 day or up to 2 weeks has dropped. As people become more technically astute, do more research, and become more educated about Medicare plans, that combined with a higher level of personalization should lead to it taking less time to successfully complete enrollment. Bill, how can you help our audience find some ways to protect your members?
Thanks, Jeff. So let's take a quick look at what it takes to retain or protect current members as they transition from the working world and commercial insurance to retirement, aging into a Medicare plan. What strategies do you need to prevent switching from one plan to another if you have rate changes or if plans are sunset? And then let's talk a little bit about the impact of cost savings, not just from moving to generic drugs, but how therapeutic alternatives could impact costs both for the carrier as well as for the member. And your ability to provide critical information will help you retain members. We all know it's a lot less expensive to keep a current customer than to acquire a new one, right? So how do we make sure every health plan member stays with the same brand as their current plan or their current carrier once they retire? It's an ever-changing marketplace, and innovative strategies, and some of these strategies that we'll talk about along with technology can help keep your members with your brand. So staying connected is critical. This requires delivering the right information at the right time. Reaching out early is important to members with the best fit plan options, as we've been talking about, based on their health history and based on their medicine cabinet or drug list. And make sure you connect with at-risk members who might be checking out their options as they browse for a new plan due to rate change or other plan changes that you might be making. Members do have options. Connections can be difficult to maintain, and so let's dive a bit deeper into how personalization and automated tools can help with this retention effort. Today's technology has improved tremendously. It's possible now to have a person-to-person connection with virtually every member. Our customer buying behavior surveys show that the more personal and authentic the relationship you have, the more indispensable it becomes for the consumer. But the right tools are definitely necessary to support this personalization. They require consuming or importing demographic information, plan data, drug data, combining them into a retention tool, technology tool that's primed to allow you to proactively reach out to members. And we found that with this preloaded information in a system specifically designed to handle finding the best fit plan for those consumers who are aging in or transitioning from group to commercial insurance or at-risk members, these tools allow you to keep that connection in place, and you're going to end up reducing switching. You need to make sure you're reaching out at the right time, and you need to make sure that you keep that personalized connection alive. Let's look a minute at who is, when it comes to Medicare plans anyway, and plans overall, what's the path of least resistance? Who doesn't benefit from making a change, and who might be fearful of switching? As we look at our survey data, it shows that those in poor health are less likely to switch to a cheaper plan. Aging consumers would need more information on what the savings would be, as well as the impact that switching would have on their provider that they currently have. And older seniors are less likely to switch when compared to younger boomers. Those already on Medicare are less likely to switch to another plan if it costs less, and that year-over-year trend has stayed pretty stable. Medicare switching, as we've seen from DEF research as well, is fairly low. However, it's worthy of mentioning that this survey is across multiple plans, multiple plan groups, and 50% of all consumers across all plan groups said that they would switch plans for a savings of less than $100. So Again, total annual cost is critical, finding that best fit plan as well. Let's look a moment at the flip side and what gets people to switch. This is DEFT research, and here we see that nearly 1/3 will switch for dental coverage, which is up 21% from the prior year. Also noted here, high premiums, expensive brand copays, high out-of-pocket, and being charged more than expected were not only reasons for switching, which is on the vertical axis, but on the horizontal axis, they're also part of the reason for the negative experience that beneficiaries feel. These items, the out-of-pocket items, are all related to overall cost, and you'll see premium is also a switching trigger, but consumers are definitely starting to home in on annual cost, as Jeff talked about, versus just premium. So again, finding the best fit plan is becoming more and more important versus just selling a zero premium plan. Using member information to personalize the experience, determining the best fit plan from the get-go, right off the bat, can definitely lead to greater plan satisfaction and improved member retention because it removes many of these variables right up front that impact switching. And having a tool to do that is very, very important. Let's take a different look at drug alternatives and retaining members with drug cost savings. Another strategy to help retain members, which again is supported by our consumer survey responses, is to provide members with accurate cost savings information. We know the number of prescriptions increases with age, as Jeff talked about, and our survey indicated that as the number of prescriptions increases, so does the interest in finding cost-effective therapeutic alternatives. They want options, they want savings, and you can become a resource for this information when you demonstrate that the savings of generic medications really is far less than the cost that can be accrued to both the member and the carrier, frankly, with therapeutic alternatives. Our data has shown that with therapeutic alternative savings, approximately 75% of the savings accrues to the carrier and about 25% to the member. So there is significant savings over just switching to a generic. So let's try to bring this all together and summarize. We've talked about several strategies to reach today's modern senior, really on a personal and relevant level that make good sense. And we believe it's going to be key to your ongoing success. Online shopping has stabilized after a 5-year growth trend since 2012. Shoppers will continue, however, to need assistance with their enrollment. Even though they're shopping online, we see a high percentage using an assisted channel. Healthcare, Medicare in particular, is all about trust. People, especially aging in consumers, trust Bob. They trust Bob the broker, right? They don't necessarily trust the healthcare system or the government system quite as much as private carriers, but they trust individuals and they need the guidance that Bob provides, frankly. Do you have a strategy for how you'll handle MA and Med Sup offerings with, as we saw, consumers aging in later, they're working longer, they typically have a bit more financial support, and they're certainly more geographically mobile. It's very important to have the products available that they want. We also talked about how zero premium plans can actually, in some cases, be more costly for the beneficiary. And so helping the beneficiary, the member, find the plan that's right for them based on their particular health situation and their medicine cabinet is really important. What are you doing to expand your network? Have you looked at new distribution opportunities to broaden your reach? This is an important strategy as well. And what about your communication strategy? Do you have a targeted and personalized approach to make transitions and aging in early easy? Being there when they need you is important, and trying to make it a no-brainer for each person to transition from under 65 insurance to Medicare is very important, helping them stay loyal to your brand and reduce switching. Thinking about how you'll guide consumers with a high number of prescriptions versus those with lower numbers, obviously. There's probably some interest in therapeutic alternatives. Our data showed that, especially as compared to the cost savings with switching to generics. There can be a significant additional cost savings there. And everyone wants to know what the drug costs mean to the out-of-pocket and overall annual cost to them. So I guess above all, get personalized. Personalize your shopping experience, personalize your message, and personalize your contact with the consumer, the beneficiary. Grow and adapt with your consumer and your member. And once you capture and convert, you'll certainly want to put strategies in place to protect them, to retain them, and keep them close. And always be able to answer the question, what's best for me? What's best for me as a consumer on a personal level? That's what they're looking for, is what's best for them. So let's take some time here for questions, and we'll take a few minutes. First question is, how is Connecture involved with the new Medicare Plan Finder? And we'll talk a little bit about how that's going to affect consumers this AEP. It's been on a lot of people's minds and a lot of press about it, a lot of articles about it as well. And so change is always a challenge. We were involved with CMS for years and years. They've gone, they've gone to internal vendors to produce a Plan Finder. And this seems to have created a lot of confusion. We believe that confusion is going to drive consumers to other channels, carrier call centers, brokers, and so you best be prepared for increased volume and provide that personal assistance we've talked about. Yeah, CMS noted, if you're paying attention to what CMS is trying to push consumers to do, they will need to have a login to Blue Button. They're going to have to set up a profile in Blue Button in order to pull down their medications, rather than having the ability to save a drug list on the .gov site. So this is going to create more steps and perhaps more confusion for the consumer. And we believe that it's going to drive people to private channels. So I think that's important. So let's see. You know what, there's one here. We always encourage zero premium plans. How will we benefit time-wise or other by focusing more on annual costs? Seems like more work. Jeff, do you want to talk about that one?
Yeah, sure. Thanks, Bill. That's an interesting question. So as we discussed earlier, when you take time to enter prescription drugs and possibly even a pharmacy, what I've seen in the past was you'll allow the consumer to better understand the total cost of the plan. Remember, we talked about the $0 premium plan. That's not always the best fit plan for the member or consumer. And so just taking the time to focus in on those key factors, along with provider information, to facilitate getting the right plan for the right member at the right time. I can't stress that enough, that looking at total out-of-pocket costs is a much better measure than just looking at premium.
Got it, thank you. Looks like we might have a little follow-up, I guess, to that, sort of. With regard to brokers not entering drugs, and looks like picking more zero premium plans, where does this data come from? I can answer that one. So every year we do approximately, well, last year we did about 700,000 enrollments. We analyze that data via our, from our Connecture customers, our carriers and multi-carriers, or brokers and FMOs. And it showed that consumers and call centers, internal telesales agents do in fact enter drug information. The consumers are willing to do it. Telesales agents take the time, and brokers tend to not do that. They tend not to take the time. And in fact, Deft Research confirmed some of this in one of our presentations with Deft earlier in the year. They talked about how 51% of enrollees will enroll in a plan with a premium, even though a zero premium plan exists. And our belief is that this is due to the fact that the overall annual costs are lower, and essentially they're enrolling in the best fit plan versus the plan with the best annual cost for their drug profile, their medicine cabinet, versus just picking the zero premium plan. So our sense is that that drives higher satisfaction and as well as higher retention. Let's see what else we have. How can we increase online conversions right away as soon as AEP starts? Jeff, do you want to take that one?
Yeah, sure. Thanks, Bill. That's a great question. As we all know, shopping starts on 10/1. People are going to call, right? And you can have the ability to provide tools that help consumers find the best fit plan at that point in time. When you're doing shopping, you can enter in your prescriptions, you can enter in your provider data for the next plan year. You may not be able to enroll, but at least you'll be able to help people find the right plan for them so that when it comes time for 10/15, you'll allow them to enroll in that plan that they already know about. We know that consumers may shop online instead, and then they may end up using a decision channel to make the final decision. When you have a tool that crosses both channels and it's all integrated, then you can allow for the best of both worlds. You can allow them to shop online and call in, or vice versa. And so the key is when 10/1 starts, we all know that people are going to call no matter what. So take advantage of that time. Try to find the right plan for them. Try to find the best fit plan for them.
Jeff, kind of on that vein, we did get a question, and we don't want to spend a ton of time talking just about the Connecture platform, but question came in, can you save your drug list in the Connecture platform?
Yeah, that's a great question. As we're starting to see what's happening with Medicare.gov and the blue button process, Connecture's always been able to save drugs as long as you create an account. So if the member does that online, or if the broker or the agent's doing that for them, as long as you're not just shopping, as long as you're creating an account, you can do that. There's options to do that, whether you get to enrollment or not. But once you create that account, then those drugs or those providers or whatever you entered in, and including up to putting something in the cart, will be there for the consumer to see online, so that you can come back and see that as you go forward.
Got it. Thank you. There's a question about therapeutic alternatives. What do you mean by therapeutic alternatives? Therapeutic alternatives are not like acupuncture. Therapeutic alternatives are similar drugs with the same efficacy, and we actually have been the gold standard for drug costs since the early 2000s, and have a team of pharmacists that have built the drug database that we have and produce in a product called Drug Compare. And we have studies that shown that generic alternatives do save money, but we have a number of PBMs as well that use the therapeutic alternatives, whereby you enter a medication and find a similar drug with the same efficacy based on pharmaceutical principles, based on the chemistry, and that savings that accrues is typically much, much higher than generic alternatives. So it's absolutely not some funky treatment that you would think of like it is actually medications that are deemed to be, from a clinical standpoint, therapeutic alternatives for that particular medication. So let's see. If I want to get through a call quickly and move on with a consumer, what tips can you offer to shorten these calls with a consumer? I can take that one. What we found is tools that help the consumer shop, where you can quickly enter in the meds list, find the best fit plan based on total annual cost, make sure the provider is in the network, and then brokers can send a quote. And with our tools, you can also send a PIN, a personal PIN code that would allow the consumer to actually log in to that quote and see the plan that is the best fit plan for them and do a self-serve enrollment, really. And so, allowing the broker to quote, send a quote with a PIN-based kind of landing page, if you will, to allow that consumer to do a self-service enrollment will save a ton of time for the broker and agent. And as we showed earlier, our customer statistics show a 63% continuation rate. It's not necessarily a conversion rate, but it is a continuation rate that once a quote is received, the consumer continues to the next process and does enroll. So I think that's important to have those time-saving tools for the brokers. So let's see. So will all plan searching be behind the wall of blue button? No, the .gov site was intended, I'm not sure if they're there yet, but the .gov site, it's intended to allow the consumer to find their best fit plan. In order to get drugs, my understanding is that the consumer will need to log in and set up a profile in a blue button to pull down their drugs. How is Connecture drug pricing determined? What sources used? We have, obviously, because we do a lot of business in Medicare, we have formularies, and that is our, again, we have been the gold standard for drug pricing for years and years and years, based on the formularies from the carriers across the country. So when we load those up, we have all the drug pricing across Medicare. Will a consumer still be able to get a generic quote for plans in their zip code? Jeff, you want to take that one?
Sure. So the basic answer is yes. The consumer will be able to do whatever shopping they want to do and try and find the right plan for them. Logging on can be done at any point within the flow. It has to be done once you're starting into enrollment, but outside of that, yes, the consumer can shop without having to log in.
Got it. All right, let's see. Okay, it looks like we have maybe one more coming in, but let's wrap it up. I guess, Jeff, if you had to take one key message away from today's presentation, what would that be?
That's a great question. Out of anything, if you can just take this one takeaway, take the time to personalize. It's going to help for retention. It's going to help the member. It's going to help find the right plan for whoever is buying it. It'll just looking at premium, and can't stress this enough, looking at the $0 premium is not the right option for people. When you're taking the time to enter in all everyone's providers and drugs and figuring out what's the right plan within all of those combinations, what's the right out-of-pocket costs that get me to the right total cost versus a premium. I can't stress that enough. You really need to personalize, personalize, personalize.
Great, thank you. And thank you all for attending. One last note, you can contact us at our website, connecture.com, and you can send direct questions to marketing@connecture.com if you have additional questions. And certainly for those of you that have attended and all the registrants will receive an email with a link to the recorded webinar and be able to get in additional information. And again, thank you all for attending. Have a great rest of the week.